In this podcast episode, Dr. Gabrielle Lyon, a physician specializing in high-performing individuals, discusses the critical role of skeletal muscle in promoting longevity and overall health. She explores the importance of muscle mass for metabolic health, the psychological aspects of motivation, and the impact of lifestyle choices on well-being. Lyon also emphasizes the need for resistance training, dietary protein, and the significance of building trust in therapeutic relationships to foster lasting health improvements. Lyon emphasizes the critical role of skeletal muscle as a vital organ for longevity and overall health. While society often focuses on obesity, Lyon argues that the real issue lies in the lack of strength and muscle mass. Research indicates that individuals in the lower third of strength have a significantly higher risk of mortality from various causes. Therefore, prioritizing muscle health is essential for preventing disease and optimizing performance as we age. As a physician specializing in high-performing individuals, including athletes, CEOs, and military personnel, Lyon helps her patients overcome physical restrictions that hinder their performance. She believes that health is the foundation for achieving one's potential, and individuals cannot rise above their health limitations. Many of her patients report feeling they could perform better, but struggle with low energy, poor sleep, or other health issues. Lyon employs a holistic approach, utilizing environmental testing and hormone assessments to identify and address these concerns. When discussing the complexity of her solutions, Lyon notes that while the physical aspects can be straightforward, the mental component is often more intricate. Recognizing patterns in both physiology and psychology is crucial. Many high achievers experience significant emotional lows after reaching their goals, which can lead to burnout. Understanding this cycle is essential for maintaining health and performance. Lyon identifies worthiness as a key factor in motivating individuals to make changes. If someone does not feel worthy of good health, they are likely to sabotage their efforts. She emphasizes that while discipline can be practiced, motivation often stems from a sense of worthiness. To assist someone who feels unworthy, she would first assess their sleep, diet, and overall health, then guide them through a process of self-discovery and empowerment. Lyon shares a case of a patient who struggled with sleep due to past trauma, highlighting the need for a therapeutic relationship that transcends transactional interactions. Building trust is essential for helping patients confront their vulnerabilities and make meaningful changes. She believes that many people wait until they experience significant pain or health issues before seeking help. Lyon encourages individuals to take proactive steps toward their health rather than waiting for a crisis, emphasizing that the decisions made today will impact future health outcomes. Lyon discusses the psychological aspects of stress, noting that people often conflate various stressors into a single category. This oversimplification can hinder their ability to cope effectively. She points out that there are different stress responses, such as tend and befriend, and the courage response, which can enhance resilience and well-being. When addressing trauma, Lyon acknowledges that it can be deeply ingrained and challenging to overcome. She emphasizes the importance of recognizing both the physiological and psychological aspects of trauma, suggesting that individuals may need to work with a coach or therapist to navigate these issues effectively. Lyon believes that understanding one's worthiness is crucial for making lasting changes. She encourages individuals to focus on their long-term goals and the benefits of physical strength rather than short-term superficial gains. Through her experience with thousands of patients, she has learned that the most successful individuals are often motivated by a desire to serve others rather than self-interest. This perspective can help shift the focus from external validation to internal fulfillment. Lyon highlights common myths that inhibit change, such as the belief that physical appearance is the most important measure of health. Instead, she advocates for focusing on physical readiness and performance, which can lead to a more fulfilling and sustainable approach to health. She states that a strong body cannot exist without a strong mind, emphasizing the need for individuals to cultivate mental resilience alongside physical strength. Lyon highlights that individuals in the lower third of strength have a significantly higher risk of all-cause mortality, compared to those in the upper third. She challenges the notion that aging must be accompanied by weight gain and muscle loss, asserting that anyone can build muscle and strength at any age. This misconception often stems from observing older generations who may have become less active and gained weight, leading to a belief that this is a normal part of aging. Lyon points out that societal norms and repeated messages can shape our beliefs about aging and health. The traditional view of aging often overlooks the importance of skeletal muscle, which is vital for health and longevity. If she had to choose one factor to promote a healthy life, it would be muscle mass. She argues that resistance training is irreplaceable and more critical than cardiovascular exercise for maintaining health as one ages. Lyon notes that only 6 to 8% of Americans meet resistance training guidelines, with a significant portion of the population being sedentary. While life expectancy may be increasing, this does not equate to a high quality of life. Maintaining physical autonomy and the ability to perform daily tasks is often compromised as people age and lose muscle mass. Lyon discusses the differences in aging across cultures, mentioning that some communities, like her father's in Ecuador, maintain high levels of physical activity and muscle mass into older age. This contrasts with the more sedentary lifestyle prevalent in many Western societies, where convenience often trumps physical activity. When addressing weight loss, Lyon emphasizes the importance of muscle mass in regulating metabolism and appetite. She argues that focusing solely on fat loss can be misguided. Instead, the conversation should shift towards increasing healthy skeletal muscle. Muscle helps store glucose, reducing the likelihood of it being stored as fat, and higher muscle mass can lead to better metabolic health. Lyon discusses the role of medications like Ozempic, often prescribed for weight loss. While these drugs can help manage appetite, they should not replace the need for resistance training and proper nutrition. Many individuals lose muscle mass while on these medications, not because of the drugs themselves, but due to a lack of training and inadequate protein intake. Advocating for a focus on dietary protein, Lyon emphasizes its essential role in maintaining muscle mass, especially as individuals age. Older adults need more protein than younger individuals due to anabolic resistance, where the body becomes less efficient at utilizing protein for muscle building. She recommends a protein intake of 0.7 to 1 gram per pound of ideal body weight. Lyon explains that low testosterone can manifest in several ways, including decreased energy levels, reduced muscle mass, increased body fat, and diminished libido. To boost testosterone levels, she recommends a combination of resistance training, adequate sleep, and proper nutrition. Lifestyle factors, such as reducing stress and avoiding exposure to environmental toxins, also play a significant role in hormone levels. Lyon shares her personal fitness routine, which includes training 3 days a week with a focus on resistance training. She incorporates her children into her workouts, emphasizing the importance of modeling healthy behaviors for them. Her routine is structured yet flexible, allowing her to adapt based on her energy levels and family commitments. Lyon provides practical tips for building muscle, emphasizing the importance of consistency and incorporating movement into daily life. She suggests using a weighted vest during walks or phone calls to increase physical activity without requiring a gym visit. Simple activities, such as playing with children or engaging in physical challenges, can also contribute to muscle building and overall fitness. Instead of setting specific goals, Lyon advocates for establishing standards. She believes that having a consistent standard for physical activity and nutrition is more effective than setting time-bound goals. This approach allows individuals to maintain their health and fitness without the pressure of achieving specific targets, fostering a sustainable lifestyle. Lyon concludes by discussing the importance of relationships in maintaining health. She emphasizes that social connections and support systems are vital for overall well-being. Healthy relationships can motivate individuals to stay active and make better lifestyle choices, reinforcing the idea that health is not just an individual pursuit, but a communal effort.